I'd actually put this somewhere. Good? Okay. Can you hear me? Okay. Okay. So, good afternoon and hello, everyone. Bienvenue. Akishi Yu Shinen. Tanzi. Anin. My name is Jane Curtis, CEO of Southern Health Santé Sud, and it's my distinct pleasure to be your MC here today. Together, we acknowledge that Southern Health Santé Sud is located on the original lands of Treaty 1 and Treaty 3 territory and on the homelands of the Métis Nation. We respect the treaties that were made on these territories and acknowledge the harms and mistakes of the past and the legacy of residential schools. In solemn joint mourning for the lives of the many children found across the country and potential for others to be discovered, Southern Health Santé Sud affirms our commitment in responding to the Truth and Reconciliation Commission of Canada to Actions 18 to 24. As an organization, we aim to embrace the distinct cultural knowledge, practices, and traditions of Indigenous people and to continue efforts to strengthen relationships with our Indigenous communities and the peoples whom we serve. So I would like to acknowledge you all here today gathered as we welcome our provincial partners for a very important announcement. Without further ado, I would like to call on Honourable Audrey Gordon, Acting Minister of Health and Seniors Care and Minister of Mental Health, Wellness and Recovery, to the podium.
Good afternoon, everyone, and thank you, Jane, for the introduction, and thank you to everyone for taking time out of what I'm sure is a very busy schedule to join us for the announcement this afternoon. As the newly appointed Minister of Health and Seniors Care, I want to share that I have a strong background in healthcare, and I will now bring all of that knowledge, skill, and ability to bear on this new role. And I want to take this opportunity to thank all the healthcare workers, administrators, EMS personnel, and all the individuals that have been helping to keep Manitobans safe throughout the past 18 months. I was honored to be a part of the historic announcement earlier today, the expansion and renovation of the Brandon Regional Health Centre. Today, we are announcing two projects that I'm sure will improve quality of care for all Manitobans, not only now, but well into the future. Investing in healthcare services in communities throughout Manitoba will not only improve the physical health and well-being of Manitobans, but their mental health as well. This announcement today is a part of Manitoba's Clinical and Preventative Services Plan, which was developed and led by clinical leaders and health system experts from across the province. These projects in Brandon and Portage la Prairie are the latest in Manitoba's commitment to providing better care sooner, which has included significant infrastructure investments at health facilities throughout the province. I'd now like to introduce Premier Brian Pallister. Thank you.
Hi everybody, thanks so much for taking the time to be here today. It's a big day. First of all, I want to say thank you to Audrey for her dedication and her work in public office, and to say that we all know, because those of us who work with her are just tremendously impressed with her dedication, her heartfelt compassion, her capability. We know that she'll do a tremendous job in this role. So Audrey, all the best to you, and thank you for taking that on. I also want to, because this may be one of the last chances I have, to say thank you to my colleagues who are here with us today, and through them to their friends and our other colleagues who are not here today. To say thank you to Greg Nesbitt, who is our caucus chair, to Len Eastleson. Thank you, Len, for being here. Blaine Peterson, to Ian Wishart as well, and to say to Blaine and Ian, in particular, who I've known longer than all of my other colleagues, thank you for your 25 years of service to the people of this area and to this region. We appreciate it. We appreciate your efforts, and we thank you very much for being here today. And I would be remiss, and I will not be remiss, because I'm going to say thank you now to some people that definitely deserve thanks. Some of them who have passed, some of them who are here with us today, and some who could not be. I've had the privilege since 1992 of serving with local officials in this area that are second to none in their dedication as well. And I think now of Glenn Carlson and Ian McKenzie, who have passed. I think of Ken Brennan, who is here. I think of Earl Porter, who has passed as well. And I think of Irv Ferris. And I say to those men and to their councils, who a number are here I see today as well, and those past, thank you for your dedication and service to the people of Portage la Prairie. We honor your service, and we thank you for being here today. And to Cameron Blight, who is doing an amazing job as the head of the Association of Manitoba Municipalities, to say thank you specifically to Cam, to his family for their sacrifices and efforts, and to say also to his predecessors, Toby, I don't see Toby here, but Toby Trimble. And I want to say a special mention to Jim Knight, who I see here today, who has been an incredible force of support for the Hospital Foundation for so many years. Jim, you're an inspiration to all of us. Thank you, Jim and Jean, for being here. Thank you. So thank you, Jane, for that kind introduction to us, and to say that it's a pleasure to be in my hometown today with all of you for a significant announcement. I want to thank Dr. Tan, who is here, Chief of Medical Staff. I want to thank Dale Lyle as well, our board chair for the Portage Hospital Foundation, for joining us today. Since our government took office in 2016, we have been steadfast in our commitment to provide better care to Manitobans. And our vision of healthcare means that we are the only province that's holding the line on growing wait times, a concern as our population ages, as we all know, all across the country of Canada. The last CIHI, or Canadian Institute of Health Information report, says that only one province is holding the line on those wait times, which are getting longer and longer in most areas of care. We're committed to making sure that improved access is the creed here in Manitoba, and that more services are available. And more service is not just available, but available closer to where you live, closer to your home area. And together we're taking significant steps to do that. Earlier today, it was alluded to, I was honored to be in Brandon to announce our historic investment over the next 5 years. $812 million will be invested in the infrastructure of our healthcare facilities in this province. This is the largest commitment capital investment in healthcare in our province's history, and it will support 38 projects in all regions of the province, not just Portage la Prairie. Some people say Portage gets too much with me as the Premier. I don't think so. I think Portage gets what it deserves and earns. And we're going to deal with that in a little bit, but we're going to also invest in 36 other projects besides the two I'm announcing today, all over the province of Manitoba, to build a better provincial clinical network to serve the people of this province well. And this system will improve access, it will enhance the quality of services and the reliability of care while reducing wait times. But I want to mention this. You can't just do that with a building. And I see a number of healthcare people here, professionals, people, aides, nurses, people in this crowd right now, and I want to say that let's thank them and let's thank their colleagues right across the province of Manitoba. So why are we here then? Why are we in Portage if we're just doing these projects all everywhere else? Well, we're not. We're going to do some here. But I'm going to say before I go further, there's a lot of emotion today, for me and a lot of you. We're standing in front of a building. It's not just a building, it's where we have so many emotions. There are so many things that have happened in that building. I held my grandfather's hand when he passed. I watched my wife give birth to a breech baby. You guys know that's interesting. Lots of memories of comings and goings of various kinds. Always emotional with healthcare. We've said our goodbyes and we've said our hellos. Ian Wishart said hello to new knees. Blaine Peterson said hello to a new hip. All three of us are 67 years old, and it might seem funny to say for three 67-year-old fellows that have represented this area for a lot of years. But sometimes it's time to move on even when you're only 65. This building's moving on, and we're building a new hospital in Portage la Prairie. $283 million, the estimated cost, the estimated investment. I think that there is no doubt this is an investment that will pay big, big dividends as we move forward. The new Portage la Prairie Hospital is going to be at least double the size of the existing facility. It will meet the needs of our most rapidly growing health region. And this new modern facility is going to offer more. It's going to have more inpatient beds. It'll have expanded medical and surgical capacity. And it will have an improved emergency department to serve Portage la Prairie and many Southern Health, Sante Sud, and First Nations communities as well. This significant investment for a new facility will not only replace the existing hospital with a modern one, it will also offer new and additional services as well. And this is very important because we are a growing region. And it's nice to say that, isn't it, Ken? Because we've known for many years that this was not a growing area. It was a stagnant area since the 1930 census. But the next census will show this area growing for the first time in almost 100 years. And we need health facilities to match that growth, as our people need that care. And it's also important to understand that when you need health care, you don't need an extra trip. And for folks to have to travel to Winnipeg or other centers to get care is an added stress on a family and on the resources they have, and time being one of them, but the emotional resources and mental health of people matters as well. And so having additional services closer to home is incredibly important and beneficial. I want to recognize the commitment of the Foundation, Dale, and say through you to your committee members and to your predecessors as well, special thank you. Because that foundation is a key part of, through its tireless efforts, advancing the critical work of improving health care and improving the lives of the wonderful people who live in this community, in this area. I grew up in Portage, and I know how much the people of this community have to offer to one another, as you have throughout your history. Health care is no different. Today's announcement of this new hospital is because of the hard work of so many of you. You've made this possible. Thank you. Our government's investing in better health care. We are investing in the health and well-being of the people and communities of rural Manitoba, and I'm proud to say that these announcements today aren't the first. They follow many others. I will mention some. Throughout our province in recent years, we constructed, as many of you know, the Selkirk Regional Health Centre was built. It's a beautiful facility. In addition, new emergency departments in Flin Flon, in Dauphin, new ER at the Grace, a new ER at St. B. I hope you haven't had to be in all of those, but if you have a chance to see and talk to the folks who work in them, you'll know they're better facilities than ever before, offering better services than ever before. Today's a great day. It's a great day for the future of healthcare in Manitoba, and as I always say, the only thing better than today in Manitoba is going to be tomorrow in Manitoba. Thank you.
Thank you very much, Premier and Minister Gordon. This event, it certainly marks a historical moment for Southern Health Sante Sud, as well as the community of Portage la Prairie and surrounding areas. But it also celebrates relationships and partnerships. I would like to acknowledge and express sincere thanks to the province of Manitoba and Manitoba Health and Seniors Care, who have partnered with us on our journey today. Please know that this enhancement will better enable better access and quality of care to the citizens of this area and beyond. Thank you again to the provincial partners we have. We are equally proud to partner with many communities in our region to deliver a range of quality services across our region. It takes a community to care for the people who live in it, for the elderly, the vulnerable, the sick, and the healthy. The Portage District General Hospital Foundation has been a solid partner for many generations, spanning through the years as they worked with the Portage District General Hospital Board, RHA Central, and today with Southern Health Santé Sud. The Foundation's vision and mission has remained solid and unwavering. They support us in enhancing, enriching, and maintaining a high level of safe, high-quality health care. I can personally attest to their values of working in partnership with openness, responsiveness, trust, accountability, and empowerment towards the future growth of their community. It is a privilege and a pleasure to work in partnership with the Portage District General Hospital Foundation. And now I have the pleasure of asking Dale Lyle, our chairperson of the foundation, to come forth and share a few words.
Thank you, Jane. Premier Pallister, it's great to see you again today. What an awesome day for healthcare in the city and RM of Portage la Prairie and region. The announcement today of a new regional hospital in Portage la Prairie to replace the existing 65-year-old hospital with expanded and enhanced healthcare services will serve healthcare needs in this region for decades to come. Portage District General Hospital Foundation annually funds equipment and building upgrades for the hospital. In 2018, as a result of discussions with hospital management concerning funding of hospital building upgrades, the foundation met with senior management from Southern Health Santé Sud to discuss the age and condition of the hospital and various deficiencies negatively affecting healthcare delivery. Southern Health Santé Sud subsequently engaged an architectural firm to review the condition of the hospital, which led the foundation to engaging a consultant to prepare a role statement and functional program detailing the need for a new hospital. The role statement determined the following. The current Portage District General Hospital is a regional health centre that is in dire need of urgent replacement. The current situation at the Portage District General Hospital finds the majority of areas falling below standards. This is a situation where replacement of the entire facility is crucial. That report, along with letters of support from Southern Health Santé Sud and municipalities, First Nations, school division, and businesses in the region, were then submitted to the province in 2019. The new hospital announced today will be bigger and better, providing the community and the region with a modern facility and access to many services that previously may have required multiple trips to Winnipeg and Brandon. Today's announcement will support the delivery of healthcare services closer to home for patients in a rapidly growing area of the province. Portage District General Hospital Foundation is committed to support this project financially and to focus on community engagement and regional support. The future viability of the existing Portage District General Hospital has been a focus of the foundation for many years, and I certainly want to acknowledge past chair Jim Knight is here, and he carried that torch for many years. He was certainly involved in moving the foundation along and assisting us with projects. None of this would have been possible without our amazing community that continues to support the work of the foundation. Thank you very much.
Thank you, Dale. So our next speaker really requires no introduction here at the Portage Hospital. Dr. Ed Tan is a respected physician and our Chief of Medical Staff at the Portage District General Hospital and a physician with the Portage Clinic team. He's a very dedicated physician and team member, and I'm told he was quick to respond to the invitation today, despite being away on a short but well-deserved vacation. So thank you, Dr. Tan, for being here today, and please come forward and share a few words.
Thank you, Jane. Premier Brian Pallister, First Nation and Manitoba Métis Federation leaders, elected provincial and municipal dignitaries, Terry Porter, Vice Chairperson of Southern Health Santé Sud, Jane Curtis, CEO of Southern Health Santé Sud, friends and staff from Southern Health Santé Sud and the communities of Portage la Prairie and surrounding areas, welcome and good afternoon. It gives me great pleasure to mark our appreciation on behalf of the clinical healthcare team regarding today's announcement. Today is a good day in Southern Health Santé Sud and a great day for Portage la Prairie. New space, more modern technology, and the ability to increase capacity of care with an expanded bed base that will keep patients closer to home. That is a pretty promising future. In addition to expanding clinical opportunities within our surgical program, emergency department, specialty care unit, and various outpatient services, this new modern facility will essentially resuscitate the nucleus of our health campus and give it new life. There is no question that this will have a tremendous impact on the further enhancement of patient care and comfort for people in this region and the community. It will provide a better working environment and afford better recruitment possibilities. This investment and commitment also confirms the Portage District General Hospital's continued role in the context of the Provincial Clinical Preventative Services Plan. We look forward to working together to solidify the future of our healthcare system. Among many rippling outcomes, this new health center will improve access and enhance patient safety, making it easier for clients to get the care they need. These are the details that translate into enhanced healthcare delivery. These are the details that matter to clients, so they matter to us. We often say that it is not a house that makes the home, but the people who live in it. And so it is here as well. Without a question, this new structure will be a progressive, historical moment to our story. But this address would not be complete without acknowledgement of the dedicated healthcare team whose hearts beat in tandem with those of the community. It is a privilege and honor to work alongside so many of you. I speak for the team at large in sharing our gratitude for those who entrust their care in our hands. We look forward to working collaboratively in the planning stages, but more so, we look forward to the day when shovels are in the ground and we start hearing the hustle and bustle of construction. In conclusion, thank you to the province, the Portage Hospital Foundation, community leaders, and the community for your foresight and guidance that has brought us here today. I am motivated and excited to see what is in store for the future. Thank you.
Thank you, Dr. Tan. So at the center of Manitoba Health System, as you've heard today, is the development of the Manitoba Clinical and Preventative Services Plan. As a region, together with the province and many frontline clinical leaders, we have been privileged to walk this journey on a Made in Manitoba plan to develop better health outcomes. This planning is aligned with principles that will support better patient care and sustainability of the quality care offered now and into the future. There is great and important possibilities associated with the investment of the Clinical Preventative Services Plan, and today's announcement is an important part of that planning vision. As Dr. Tan alluded to, complementary to good infrastructure is the heart that makes it beat. Together with our partners, Southern Health Santé Sud, staff provide a high level of care across the system. And although it's been said already today, I want to take another moment to thank and salute the work of the health team in Portage la Prairie and across our region and province for their challenging and valuable work. This year has been unprecedented indeed. We want you to know that you are appreciated and valued for all that you do. Thank you. And last but not least, communities represent the true diversity of our region. They come in all sizes and they come with different cultures and traditions. I cannot say enough about the community of Portage la Prairie and surrounding area. You've been hardworking, tenacious, and unwavering for many generations. Your response for support has been second to none. You are a testimony validating that all things worthwhile and possible, and that truly good things happen to vibrant and involved communities. So thank you. Together, we look forward to planning this in partnership, to breaking ground, and yes, to gather again once the doors are open. This concludes the formal program for today, and we will, I understand, have a question and answer period, and then there will be a photo op. Thank you. Whereabouts? In the grounds? I'm not sure.
Yeah, there'll be more announcements coming in the next few weeks' time, and more information in terms of the charting, diagrams, pictures, and the actual look and design of the facility that can be shared with the community and so on. So that's coming up in the not too distant future.
Let's say physical location or requiring...
Nearby.
So there was just $70 million announced for the Brandon Regional Health Center. Now there's $200 and some odd million for the hospital here. Can you sort of give us the explanation for the cost justification for this, for the number of people it's going to serve, and the size of the investments in both these areas? When Winnipeg is,
Why, your question again was, why are we building facilities closer to where people live? And the answer is because the services need to be available to people closer to where they live. The investments in terms of facilities, we can give you a breakdown in more detail. I won't look it up, but the investments are important. Healthcare is our number one priority. It is frankly, in terms of spending, it's our number one priority, but frankly, we have to look after people. We have an aging population. We have a high needs area. High needs areas around the province, and the better care we can provide and the more preventative care and diagnostic care we can provide closer to home, the better. Not only in terms of the individual's needs, but for the needs of the families as well. You know, there's not a person here who hasn't had themselves or someone in their family have to travel some distance to get diagnostic work done or treatment done, or to visit a family member, for example, in another facility. And we know we can't have every facility in every town. We know that. But Portage is a regional hub, Brandon is a regional hub, and we have growing populations and vibrant communities within both those centers, but also in the surrounding areas that are doing really well economically and are great places to live and work. And so having the health services closer to them is important. And we're also, of course, expanding the services and availability of a vast array of services within the city of Winnipeg, because it too is growing and the needs are growing as well. So it's about taking care of Manitobans better, and that's our focus.
For the health region, where will ICU capacity go in the new facility versus where it is right now in terms of beds?
Where will you see?
ICU capacity numbers, what do you have right now and where do you expect to be in the new hospital?
Do you want to answer that?
I'll try. So in terms of formal critical care beds, the majority of them are located in either Winnipeg and or Brandon. A major project that the clinical and preventive services team has been working on in the last few years, and even prior to this, was trying to find ways to kind of supplement the kind of higher level care, but bring it closer to home. So sites like Portage District General Hospital, Boundary Trails, have what we call specialty care units, or SCUs, which allow us to take care of the higher level critically ill patients that normally in other smaller sites would be transported immediately to Winnipeg. So those plans already exist, and the infrastructure is already here, but the scope and the nursing staff, the allied health teams have to complement that higher level care. And having a new facility that will allow us to expand our clinical and SEU services is kind of what Premier Pallister, Jane Curtis here, and everyone at Shared Health is working to try to achieve. The exact number of beds for our site, I can't tell you at this moment. Right now we have 4. I believe Winkler has 4, but there are talks with other major regional sites to develop this specialty care unit model to allow us to deliver that high level care.
If you build it, they'll come. That's the hope.
I hope they come easier. So we already do have it, but to maintain it and to grow it is the difficult challenge, especially with a building that doesn't have any more physical space. When you have patients that need this high level care, it just takes a lot more space in a normal medical bed, and a lot more team members, which is what hopefully this new modern building will allow us to recruit and expand in terms of our medical services.
If I understand correctly, Winnipeg, I mean, as we saw during the pandemic, space not the issue, but staff here, you could conceivably have staff, you just need space.
A little bit of both. Like we do have some space. A 4-bed specialty care unit is not large, especially if you kind of compare it to what is in Winnipeg. But a 4-bed specialty care unit in a facility in a community like Portage is crucial. Those patients that only need a day or two to turn around before they can get a little bit better, you can save them a trip, 2 hours to Winnipeg round trip. Having families allowed to come visit them here as opposed to travel to Winnipeg to seek that higher level care. This does not mean that we would keep every critical patient in Portage here. There is a limit to the scope of care that we can provide currently. I think that scope will expand as we are able to kind of build more services and have more infrastructure, but we'll have to see kind of what that really looks like at the end of the day.
Is there a timeline for shovels to be in the ground and the hospital to be up and running? I know there's more announcements coming, like design and location. What kind of timeline are you working with?
Who wants to tackle that?
Yeah.
There we
2025, doors open. That's the outside. It's an interesting time right now. Let's put it mildly. Okay, pandemic. Anybody hasn't got a vaccine, go get one, please. Please, everybody, let's go. Let's go. Let's go. Let's go so we can get our lives back. And I respect what your decisions are, but if you haven't got one, please do some research, take a look, talk to your friends, and remember, we need to protect one another, so please do that. Once we get this pandemic, it'll be endemic, right? It's not going to end, that there's not going to be COVID. We know that. But we can create an environment of safety for each other by getting vaccinated. So our numbers have been good, but they're really dropping off. We need to encourage each other. If you've got friends, I ask you, I know you do, right? You've all got friends. Reach out. If you've got friends who have yet to make that decision, please urge them to. They'll listen to you more than they'll listen to me, right? We all know that. So let's go. Let's get more people vaccinated. Let's get our lives back. And then we can start talking about critical care outside of the concept of just thinking about the pandemic first all the time, because it sure supplanted a lot of surgeries. It's delayed a lot of things for a lot of people. These are the forgotten people, I think, not by me, not by you, I hope, but these are the folks that are waiting for care right now, right? And that's why we're expanding these services. Pandemic has taught us a lot about what we need to do going forward. Our analysis, our team, province-wide teams come up with some brilliant plans, and they've been educated as a consequence in part of the pandemic to know where we need to go. We're going to a better place now. We're going to get through this thing together, and we're getting ready to take care of each other as we age and as we need that care, like Mr. Wishart and Mr. Peterson and I, who are all 67, all younger than this facility and not in need of any more body parts to be replaced, right, guys? Okay, but when we need that, we want to be able to do it in Portage la Prairie.
Mr. Premier, on that note,
Yep.
will you confirm that there will be a vaccine mandate for healthcare workers?
No, I will not confirm that. I'll talk to you tomorrow.
How about the mask mandate you hinted at earlier today?
I beg your pardon?
Earlier today you hinted also at a mask mandate. So
Well, I was just hinting. I'm going to talk to you tomorrow, and we'll see what happens tomorrow. Today, we're talking about a healthcare facility that's been needed here for a long time, and I think everybody's pretty excited about it right now.